Next, we've got another doctor, a great doctor. We've got Dr. Kareem talking about, obviously, matters of the heart. So I think we're going...
Okay, can we please have a real warm welcome for Dr. Kareem? Let me hear you. Kareem!
I may not have the voice of Dean Shawhan or, or the appeal of Dr. Shaw, but what I'm going to be talking to you about this time is very important. And I would like you to please pay attention to some of the things that I'll be saying. Now, we had Dr. Anosike earlier, who spoke to us about information, the usefulness of getting information about our health and our heart. We had Dr. Shaw came up and talked about emotional release and love and all those emotional issues and how those can affect our health. I'll be talking to you about mental health as it relates to the heart. I'm sure we know many of these things, but we probably all need to remind ourselves of the connection between the body and the mind. What they call the body-mind paradigm has been in existence for centuries. People have always known that the mind and the body are connected in a way. So I'm going to kind of break down how heart conditions or heart diseases can relate or can affect your mind and lead to mental health problems or mental illnesses. And I'm also going to be talking to you how somebody that has a primary mental health problem may go on to develop heart condition. Work with people with mental health problems on a day-to-day basis. Now, what this slide shows us is what I've been saying earlier, that the mind and the body is connected. People with heart diseases primarily can go on to develop mental health conditions as a result of the heart condition. People with mental health problems can go on to develop heart diseases. Now, and I will tell you later about statistics. 10% of people with mental health condition are liable to develop cardiac problems without any secondary interventions, without any secondary multiplier. Now, people with mental illnesses, major mental illnesses like schizophrenia, also use medications, and some of the medications that they use can actually make them become predisposed to heart conditions, and we'll talk about that as well as we go along. Next slide, please. Now, when we talk about heart disease or heart diseases, and I think Dr. Anosike actually mentioned this earlier on, we have to see we cannot look at the heart in isolation. The heart connects to other systems in the body. So we actually like to look at heart condition from the point of the heart and the vessels. So you've got the veins and the arteries and so on, and also the organs that are very vital to the heart. And that's why you've got that picture there. So what is it that can happen to your heart? You can have your heart enlarged, what we call hypertrophy, which can lead to heart failures. The heart can be, the vessels of the heart can be blocked, just like Dr. Anosike illustrated earlier on. If you have plaques settled on the vessels, either cholesterol or any other thing, then that vessel can be blocked. And if the vessel is blocked, then it's not supplying the heart properly, and the heart will begin to dysfunction, so to speak. You can have damage to the vessels, you can have damage to other organs, which can then lead to heart problems, or you can actually have infection of the heart, what we call myocarditis. So there's many different things that can happen to your heart, which we call heart diseases. The next slide, please. Now, there are a lot of mental health conditions that can lead to heart problems. But for the purpose of this talk today, we're going to be looking at stress. And I think Dr. Anosike mentioned stress as a multiplier of depression. Because if you had a heart condition, let's say a heart attack again, and you're unable to walk, you're not as active as you used to be, that can lead to low mood, which eventually can lead to depression, clinical depression. People can develop what we call post-traumatic stress disorder, what they used to call shell shock syndrome. Now, it's not only people that go to war that develop post-traumatic stress disorder. People that have very serious heart condition like a heart attack can actually develop post-traumatic stress disorder. There's also what we call adjustment disorder, which is people not able to become adjusted to a new situation that they find themselves. Many people don't eat much or they don't eat well. Other people actually eat a lot. I know people who, when they are stressed, they will eat large bars of chocolates and things like that to cope with the stress. So stress can affect our eating patterns, and if we eat unhealthily, secondary to stress, that can predispose us to heart conditions. Again, if we are stressed, we're not likely to take regular exercises. If we're stressed, we're more likely to smoke. And if we're stressed, our adrenaline level is likely to rise. Now, adrenaline is not a bad thing. It's a good thing. And I'm sure you've heard about the fight or flight scenario, isn't it? Where if, as we sit here, let's say a lion walks in through the door, what will happen is a lot of us will go that way and run off, get off our seat and run away from here. The reason we do that is because our adrenaline shoots up as a result of the threat, and therefore we react by running away. That adrenaline is very good because adrenaline actually makes your heart beat very fast and makes it healthy. However, if you have a lot of adrenaline over a long period of time, it damages the heart. And people who are stressed have continuous pumping of adrenaline, and so the heart becomes tired of this adrenaline thing. Due to your stress, again, you need to ask for help if you're not able to. A lot of people go to the pharmacy and just buy off-the-counter, off-the-shelf medicines. I don't really advise that you do that. It's better if you're so stressed that you can't sleep, that you consult your GP and they will advise you appropriately on what to do rather than go and buy all these herbal sleep tablets, Nitol, and all those things. Because again, many of those medicines, you don't know what side effects they are likely to cause in the future. Next. And then we go on to anger. I think somebody mentioned anger earlier on as a possible factor for heart disease. It is actually true. There's a proven mechanism by which anger can lead to heart condition. And that is what I've done there. Of heart attack that is traumatized by that event, the family members also can be severely traumatized by the heart attack of their relative. So we need to pay attention to all these things holistically and not just focus on the person with the heart attack, because the son or the wife or the husband could also be psychologically affected by the heart attack. Next. And what should you not do and what should you do following a heart attack? It's very important that you do all those things under the green circle, which is express your emotions, review your experience, rest, try and be with family and friends, don't smoke or drink alcohol, and don't self-medicate, and take care around the house so you don't fall and get a shock and develop another one. Don't bottle up your feelings, avoid talking or thinking about what has happened. If you feel that you developed in sleeplessness for a long period of time, if you find that you're having nightmares or your physical symptoms are persisting, or you are feeling low in mood, then you should really ask for help. And where do you get the help from? I think in this country, the best thing to do is go straight to your GP, and then your GP can signpost you to sources of help, depending on what your specific complaints are. Again, you can go to any of those organizations. The Samaritans are very good. They support people with psychological problems, including marital problems and all those other stressors that can lead to heart conditions. Relate is very good with relationship problems, not just husband and wife. It could be relationship problem between son and father, of daughter and mother, and so on and so forth. Or if you have this means, you can contact a counselor or a licensed psychologist if you feel that you're developing psychological problems